Hi everyone, this is the NeuroKidz, where education meets empowerment one brain at a time. Now today we'll be learning about dementia, and this is the second episode about our series of breaking the common myths of neurological diseases. So now what exactly is dementia? Dementia is a progressive neurological syndrome characterized by declined cognitive abilities, including memory loss, damaged thinking and reasoning, with difficulty language and communication, as well as behavioral and personality changes, in which this can allow having the ability of able to coping with day-to-day life really hard, especially for older people. Now, how does it affect the brain? Now, the way it affects the brain is that the development of the aberrant protein deposits in the brain, which is a substance in the brain that is required for its growth and such, impairs the normal functioning of the brain cells and synapses, which I will go or more on in the next slide, which is because it's related to neuronal cells, as well as which is linked to dementia. And the brain experiences the creation of the tangles within the cells as well as the accumulation of beta amyloid plaques outside the cells, which again destruct in its functioning and structural techniques. And these deposits, which are the plaques, obstruct the communication between the brain cells, causing them to malfunction and eventually die. So the neurons cannot communicate as well properly. That means that there'll be problems with the neuronal cells communicating within the synapses, and this can lead to permanent damage in the brain. Now, moreover, reduced blood flow to the brain deprives brain cells of oxygen and nutrients, causing injury and hindering normal brain function because the brain requires blood flow, which provides it with sufficient oxygen in order to survive and work sufficiently. Now, as you can see here, we've got a picture of the healthy neuron and a damaged neuron. And in the healthy neuron, you can see there's no real problems in the synapses. They're being able to communicate properly. There's no plaques, and it looks like a really normal neuron deposit area. However, the damaged neuron, you can see a really huge brown plaque, and this is a protein deposits in the brain that's affecting the synapse, which is a gap between the neurons, in which the neurons communicate with each other as it releases a chemical into the synapse, which is then dissolved in the substance using enzyme, and then it stimulates the electrical impulse in the next neuron so that it can also work, and therefore the plaque then destructs this function so that it can no longer work properly, and this therefore hinders the normal brain function. Now, what exactly are the most common symptoms of dementia? Now, obviously, this includes memory, but also problems communicating, visual and spatial troubles, poor coordination, confusion and disorientation, personality changes, anxiety, and many more. And when I say many more, I also include saying like many mental health disorders are linked with dementia, such as anxiety, like previously mentioned, as well as some also fall into depression and such because of the lack of ability to cope with normal day-to-day life activities. Now, the main risk factor of dementia is age. Now, this is because the risk factor of dementia increases with age, especially beyond the age 65, as this is the age in which most research trials have shown for an increase in dementia records to be cased, as well as the common misconceptions are further delve into is that dementia is a normal component of the aging process, which is untrue, as it also can affect young individuals. Moreover, having another risk factor is having other disorders such as Down syndrome, as this can allow individuals to have early onset Alzheimer's disease by middle age, which is also an effect of dementia. Another risk factor is family, as you are more likely to get dementia if you have a family history of the disease. As many people with a family history never show symptoms, while many others do, and therefore this may lead to the contribution of having diagnosed quite later in life. Moreover, now we're going to go into the main concept of the video on what exactly is the common misconceptions of the disease. Now, the first one is that only old people can develop dementia, which I've previously. Now, the first thing is that we need to know is that some people may develop it in their early 30s as well. As a typical age of onset of dementia is in the senior years, and it is true that mostly older people develop it. But at this age, however, may be significantly lower in situations with early onset dementia. The majority of cases of dementia that develop before the age of 65 are inherited. Moreover, in certain circumstances, dementia may appear in a person's early to mid 30s as well, so it cannot be limited to only old people. Now, another one is dementia and Alzheimer's, really the same. Now, understanding them is going to be quite confusing, especially because a lot of people uh, commonly group them together. And although, yes, dementia is a common effect of Alzheimer's, it's not the same thing. This is because understanding the difference between dementia and Alzheimer's disease might be difficult because Alzheimer's disease is kind of dementia and it's a type. While Alzheimer's disease is responsible for up to 75% of dementia causes, however, this dementia may be caused by a variety of different disorders. This includes diseases such as Huntington's disease or even Parkinson's. Now, the next one is that there's a risk of violence and danger for people with dementia. Now, this is not always the case because another myth is that dementia and aggressiveness, as well as hostility, is always linked with dementia. And this is not always for all patients with dementia because violence and hostility become increasingly likely as dementia progresses, and that is true. But this violence may be caused by other dementia frustrations stemming from bewilderment because of the ability not being able to cope with daily life activities and having extreme confusion with their life, and therefore there's no conclusive reason why some people with dementia are aggressive while others are not, because not everyone can be, and it again depends on the severity of their condition. Moreover, there are suggestions for careers based on carers based on the notion that bewilderment and dementia lead to this occasional aggressiveness, and therefore this allow them to live a more normal life as well as a safe life. Now, another one is that one will never die from this disease. Now, the dementia can definitely be fatal, as many things that it's just an effect of all life and that it will eventually go away. That is completely untrue because in many situations, dementia can be lethal. The most prevalent form of dementia is the Alzheimer's disease, which is the sixth greatest cause of mortality for those who are 65 and older of age. Moreover, dementia kills more people than breast and prostate cancer combined, and one third of seniors die with some type of dementia. People aged 65 and above can also survive for up to 4 to 8 years following their diagnosis, which is quite low if you compare this to other diseases caused by the same symptoms. Now, if you have memory loss, you have dementia. Now, I want to clear this conception up is that memory loss does not equate to dementia because there are many type of disorders that can cause memory loss, as it's even though that memory loss is often the first symptom of dementia that alerts a person or their loved ones that there is a problem with the individual and that they need to be taken to a hospital. Sometimes, or mostly actually, amnesia is a natural component of the aging process. Furthermore, moderate cognitive impairment, which is MCI, is a state between normal aging memory loss and dementia. Likewise, dementia causes a range of different symptoms to which they're diagnosed through, not only having memory loss, which I've previously mentioned in these slides. Now, another myth is that dementia is untreatable and that people have to kind of suffer through the symptoms all through their life. And this is untrue because with proper medication, they can live full lives. As even though most types of dementia have no actual cure yet, early detection therapy can significantly improve the symptoms and standard of life. Some dementia causes can be treated and managed to decrease the course of symptoms to a point that the patients may only experience the symptoms very mildly. Furthermore, some lifestyle variables such as frequent exercise, a good diet, mental stimulation, and social involvement may help minimize the incidence of dementia. Here's a video that shows how living with dementia can really be, and it's extremely informative. And we'll also have the link to the video in our bio, so please do check it out to get more information and insight on the disease. So now, thank you for watching. I hope you found this video informative, and so please like and subscribe to our channel. Make sure to visit our website, thenewkids.org, and follow us on our Facebook page where you'll find more information about the program.